in this panel, we're going to hear from three pairs of researchers and policymakers who've worked on large-scale impact evaluations and then scaled up the results. So the first pair is Bambang Widianto, who we're going to hear from in a minute, and Professor Rima Hanna. So Bambang is joining us in a pre-recorded video from Indonesia. He is the Executive Secretary of the National Team for Acceleration of Poverty Reduction, otherwise known as TNP2K, which is, even that acronym is quite a mouthful, I find. His team is directly chaired by the Vice President of Indonesia and is responsible for policy reform and the coordination of poverty reduction programs across Indonesia. Professor Rima Hanna is one of the researchers involved in this work, in this collaboration with TNP2K. She is the Jeffrey Chan Professor of Southeast Asian Studies at the Harvard Kennedy School, co-director of Evidence for Policy Design at the Kennedy School, and also scientific director of JPAL Southeast Asia. And she has a long history of doing research in Indonesia. But first, we're going to hear from Bambang from his side as a policymaker in this collaboration.
My name is Bambang Widianto. I'm the Executive Secretary of the National Team for the Acceleration of Poverty Reduction in Indonesia. This team is chaired by the Vice President. In the new era, where decision-making process is not only top-down, evidence-based policy become very important. And collaboration with research institution is become a must. And one of the research institutions that we collaborate is with JPAL. One of the poverty program that we want to improve in 2010 is the Raskin program. Raskin program is distributing rice to a poor household. At the time, we're supposed to distribute 15 kilograms for each household. But in fact, the poor household only receive like 6 to 7 kilograms. So at that time, we desperately want to find ways to improve our delivery system. And we collaborate with JPAL to find what is the best way to deliver this Raskin. And one of the suggestions based on their research is give the poor household a card as identity. So before that, the JPAL did several trials, randomized control experiments with a different type of card, whether it is like a voucher, whether it is a regular card, and the result is the best way to deliver that household will get 15 kilograms of rice is using the card by sending this card directly to the poor household, and then the poor household will take the rice from the distributing point of Bulog. The other important thing come out from JPAL research is how we do socialization. So socialization is become very critical. And because of that, we be able to increase the amount received by the poor household. Now they receive around 10 kilograms. It's not yet 15 kilograms, but it's already increased almost twice. When we did the research, it was funded by Australian government, the DFAT. So that's why this research, and we can adopt the research, become a policy. It was a success because we have a very good evidence base from the research. And when the JPAL doing the trial and the experiment, it was only about 1 million households. because the result make us confidence. So we increase the number of households up to 15.5 million households. I think this is the biggest delivering system in the world. I think that is very important to have a good research institution, collaboration with other countries so they can help us, with funding the research, but also finding an institution in that country that can coordinate all of this and become a broker from the result of the research up to convincing the government so it turn to be a new policy is also very important. Thank you very much.
Okay, Rima.
Thank you for having me here today and for the Center for Global Development and JPL for organizing this event. I want to start in a slightly different way, building a little bit on what Abhijit said, that part of the reason, why are we all here? At least for me, most of the research I do is really thinking about and focusing on what governments can do to improve the quality of services it gives to its citizens. And for me, this is very meaningful, even in my own life, because of well-functioning public schools in the States. I went from like a child of immigrants to first-generation college going, and now I'm a Harvard professor. And so this idea that governments can really come in and catalyze change is it's very meaningful to me. But then I'm very conflicted. On one hand, there's the social activist of me that wants to go out there and do lots and lots of things. But then there's the logical and analytic part of myself that wants to figure out, is what we're doing actually working or not? Are we actually making a difference? And I think that's very important because there's limited funds in the public and social space, and I feel like we have a responsibility to ensure that what we're doing is the right thing. And so that's why, for me, this collaboration that Pak Bang Bang talked about is so important and exciting. The idea that we could come together as a group and really think about how do we generate knowledge that fosters better policy decisions that really go and affect millions of poor households in Indonesia. So the first challenge in all of this was even just figuring out what are the right kind of policy questions that we should be attacking. Indonesia, like many other countries, is experiencing lots of growth, but many poor households are left behind. As a result, Indonesia, like many other countries, has an extensive social safety net system. RASKIN, the program that was described by Pak Bang Bang, is the largest. It's the flagship program, about US $2.2 billion a year, providing monthly subsidies for rice for about 15.5 million poor households. But the truth is, much of the rice actually gets diverted from poor households to rich ones. And due to corruption, lots of rice just plain goes missing. Moreover, it's a subsidized rice program, but many beneficiaries are actually paying up to 25% more than what they should be underneath the program. And so this kind of leakage is sadly not uncommon. One reason people talk about why this kind of leakage exists is that citizens don't necessarily know their rights from the government. Oftentimes information is filtered from the national government to the province, to the district, through the local officials and to the citizens, and that information gets mangled all along the way because of corruption, because of sometimes incompetence, lots of reasons. But in the end, even though there could be a very long-run, long-standing program that hasn't really changed much, citizens don't really know much about what's going on and what they should expect in terms of what their government should provide. And so a couple of years ago, the vice president's team, this is part TNP Dewaka, they came together and they decided to try to solve this problem. And so they decided they wanted to run a transparency program. And specifically, they came up with the idea, let's bypass all the stages of governments and get information directly in the hand of citizens by mailing out these social protection cards, which would provide information to beneficiaries, even as basic as they are a beneficiary. And so they came up with a plan, and they were putting a lot of work into it. And they went and they presented their ideas to the vice president of Indonesia at the time, who was an economist. And he, as most economists, we tend to be very negative when anybody tells us a new idea. And so he sat there and he basically said, well, these are all the ways this program isn't going to work, and we're going to spend a lot of effort and money on this. And in fact, he actually talked about a lot of the ways where providing information locally can make things a lot worse, especially if local level officials don't have the capacity to improve the program. And so he tasked his team with generating real evidence about whether or not this would work before scaling it up. Now, he gave them 6 months because if they were going to do this, it had to go into the national budget, and so we had this 6-month deadline. And so we had been working, myself and some of my colleagues, including joining Kyle, who's sitting in the crowd, and Abhijit, who's over here. We were working with Tanpedika on other research and on other activities, and they came to us and asked, can you do this experiment in 6 months and actually test out and understand whether or not the cards would have an effect? And so it was tough, but we all quickly sprang into action. We designed an experimental design working with the government on not only are the cards going to work, but what kind of information are you going to pour out on the cards? How are you going to implement it? And trying to test out different variations of it. And to be honest, I must say, all of this was only feasible because of the Australian government. 6 months is not a lot of time to design the research, much less even apply for a grant, which could take you 6 months to a year. But we had a relationship with the Australian government where we had set aside money for exactly this kind of issue, that if there's this high potential, high policy impact research to be done, but we had a quick turnaround, the money was set aside so that we can apply to it quickly and really catalyze and really spring in action. And so this was only possible because of that. So what happened? Okay, so there, I keep forgetting that I have slides. Okay, so there's the cards. So what happened? The cards were wildly successful in improving citizen knowledge and increasing what poor households received. As Pakpamang said, this basically meant poor households received more rice because less of it went missing from corruption. To put it in perspective, the government of Indonesia scaled up the card program to 15.5 million poor families in 2013. 66 million people are now better served by the safety net system. Just our experimental results suggest that this was a net reduction of $100 million a year in leakages. So I know I only have like a minute left. So I just want to note that this was part of, this just wasn't a one-time occurrence or one-time activity. This was part of a broader research agenda where we've been working with the government on a number of different projects for many years, building both the demand and the capacity for evidence. So for example, this included another evaluation between our research team and the government, an evaluation of a municipal grant program, which had also wonderful results, and then was scaled up nationally thanks in funding to the Millennium Challenge Corporation and the government of Indonesia and the Australian government. And so I think I've overstayed my welcome, but thank you.